What's up, everybody? My name's Garrett, and today I'm talking to Nate Shaw, who's a provider at Redemption Psychiatry, and we're discussing ADHD. I'm super excited to get into it. Nate, how's it going?
Going good.
Cool.
Good. Good weather. Love the season changes.
Yeah, I woke up this morning and it was cold out. I was like, yes.
Yeah,
it's the best.
Cold's when we get down to the 70s, 60s, 70s around here, where
our idea of cold.
When it's not 95 when we wake up.
Yeah, it's a good day. So today I want to talk to you about ADHD and go into what it is, how it works, who gets it, symptomology, all that jazz. But let's start with just who is Nate Shaw.
Okay. Well, I was raised in a small town in northern Arizona. Mm-hmm. I was the oldest of 5 kids, and we kind of had a blended family. And just growing up in a small town, you do small town things, and mm-hmm. As you grow up and adventure out there, my natural gravitation was towards Phoenix to get work, education, and kind of take life. So did some college early on, did digital animation, multimedia stuff, and quickly realized that, I loved it, but I could spend 80 hours a week doing stuff with zero productivity. Mm-hmm. And what did I have to show for it? And so I decided to, I got to figure things out. So I just worked for a little while and had a pool cleaning business, and I was driving and I saw a sign that, was advertising for X-ray tech. Hey, we're starting a program for X-ray tech. And so I went in there to do to check it out or to sign up. I'm like, I've got to do something. And they had a long waiting list. Mm-hmm. And so I was like, well, what else do you have? And they said, oh, are you interested in respiratory therapy? I was like, I don't even know what that is. Like, what the heck's respiratory therapy? And so they had me watch a little video about mm-hmm. it, and had me take their entrance test and stuff. And they're like, oh, we have a class starting Monday. I was like, what? Mm-hmm. Okay, let's do it. And so I jumped in, and I think that was probably the first time I ever felt smart was when I started school for something that I could connect with and understand. I think because I could just visualize what was happening when we talk about things in science. And like previous to that, like in school and stuff like that, I was not a good student. I had a really hard time. I didn't learn to read, very well until I was about 6th grade. Just kind of a lot of setbacks you don't realize are happening in real time. Mm-hmm. And as you look back and you're like, holy crap, like what the heck? Why was I, so slow at understanding this stuff? And, as time goes on, you realize, well, you're not smart. You just learn different. Mm-hmm. And I had to work really hard because I didn't like school. I got a bad taste in my mouth from when I was younger. Same. So going to do more college, right, mm-hmm. is like, wait, maybe I can just do all science all the time. Yeah. And so I was doing like biology stuff, A&P stuff was really easy for me to understand, and I loved it. And so I just did more and more and more. So as the years went on, and I finished respiratory therapy school, and I worked as a respiratory therapist for like 4 or 5 years. Wow. And I was like, man, why am I just doing this? I feel like I need to do more. And I went back to school and did nursing school. And that's where it really helped a lot, because I'd already been working in the environment and healthcare. And as I became a nurse, it really opened a lot of doors, opportunities, helped me like kind of expand my visual field, so to speak. Mm-hmm. So I could see, holy cow, there's so many other things, and there's not just like 10 jobs in this world. Yeah. And that's what led me to graduate school and eventually doing psychiatric nurse practitioner.
Yeah. So let's that's a question I actually want to hit, because it's a question that we get a lot. What is a PMHNP?
Yeah, so in the medical world, and you can go on different tracks, to practice in different areas in healthcare. And so there's the medical track, which you get a bachelor degree and apply for med school, PA school. You can branch out from that, dental and things like that, and do graduate studies or doctoral studies. And the other route that I'm more familiar with, I'm not as familiar with that route, but when I did nursing, if you have a nursing degree, a bachelor's in nursing, you qualify to, you have to have some, years of clinical experience as well. And then you can apply to graduate program, which a lot of them are doctoral programs now, or Masters of Science in Nursing, and pick an area of specialty and add on to for advanced practice. So a PMHNP is a psychiatric mental health nurse practitioner. And that is, it's called lifespan. It's a lifespan, where you're qualified to work with those of all ages. And then there's different, specialties in nurse practitioners. There's pediatrics, there's anesthesia, there's women's health, family, there's acute care nurse practitioners. And the specialty I chose was psychiatry.
Cool. So this is another question that we get a lot, and I figure we should hit it while we're here. To a patient walking in, what's the difference between meeting with a PMHNP versus an MD?
Well, it depends on the setting and the practice. There are some state guidelines or rules. Just depends on where you're at. In Arizona, and I would say specifically at our practice, it's pretty much the same thing unless you're doing a specific consultation. Dr. Friday, Dr. Burton, for instance, they have referrals that come to them to do specific evaluations for like a vagal nerve and stimulators or things of that nature. Yeah, TMS. Cool. And nurse practitioners within our practice do a lot of the other evaluations, whether it's initial evaluations or even for recommendations for treatment resistant symptoms, like for TMS, ketamine treatments and things like that. So there's not a whole lot of difference as far as when you meet with them, other than depending on, how advanced of a procedure that may be sought after. And even if you just meet with, let's say you saw me and I did an intake and, we've gone over things, and I might refer you for consultation with one of those psychiatrists that have more of that specialty or see more of those patients, and have a working relationship with like Barrow neurosurge or something like that.
Yeah. Cool. Yeah, I get that question a lot. And usually the answer is, it's like, well, for what you're doing, there's no difference, right? You're going to get the same care. But nonetheless, it's fun and it's confusing, or they'll be like, wait, they're not a doctor? I'm like, well, they're not a doctor, they're a provider. And they're like, how are they prescribing medication? Like, they're allowed to do that. And so it's like,
physician assistants,
right?
Along the similar vein, where they have privileges of, prescribing, diagnosing, prescribing, and a psychiatrist may oversee them for a certain number of hours, or I'm not sure how they work in Arizona, but in nurse practitioners, you have to meet the qualifications, and you can work independently. But you can also, like us, we work in a collaborative manner where, we have colleagues that are psychiatrists, and there's a lot of communication that goes on within our practice. We're very open. We have, within the company, we even do, we have a messaging board where, something's come up and we don't, what about this, in this part of town, or, and people that have knowledge of that, of the providers just on our chat.
Yeah.
So
cool. So let's jump into ADHD.
Sure.
We'll start just ground zero. What's ADHD?
So ADHD, I mean, it's a lot of things. And with everything from, specific diagnostic criteria to like, why is it even recognized? What's happening?
Mm-hmm.
It's a behavioral disorder that happens. It's neurodevelopmental, meaning it typically happens from a very, very young age, at birth, through early stages of neurodevelopment. And when you get to like childhood, when you're 5, 6, 7 years old, I mean, it's diagnosable because it is like the cluster of symptoms that are happening are very prevalent. And I guess there's a lot of misconceptions about it, right? Like, well, everybody has, some problems
Right.
paying attention, or like, aren't all boys, hyper?
Yeah.
Well,
Yeah. And
maybe.
it's a double-edged sword too, because on one hand, people will be like, oh, well, it's just they're hyper, so they have ADHD. On the other hand, it's like, well, boys will be boys, so even if they're presenting, they're just boy, so they don't have it, right? And it's kind of a funny line. I heard a researcher the other day. He was like, ADHD is the most over and underdiagnosed disorder because it's people so often misjudge and get it wrong.
Yeah, I think there's a lot of misconceptions for sure. There's also cultural taboos,
For sure.
I remember when I was a kid in school, and I don't know if anybody was ever treated for ADHD. I suspect maybe one kid because he was probably going to end up in juvie. It's like, well, does it have to be that extreme to be ADHD?
Does it have to be criminal?
Yeah. Well, and it wasn't even ADHD that was the problem. It was the resultant behaviors that developed because it was inadequately controlled. And so, yeah, you can have problems with inattention. And I should clarify that. Like, I thought attention deficit at some points meant like people need to pay more attention to you. So you were a bit dramatic or, drawing attention to yourself until, you're doing school and you're realizing like, oh man, inattention, like you're not paying attention.
Yeah.
And the problems that can cause. And so what problems does it cause? Let's just say, for instance, you're 8 years old, sitting in class, trying to learn, you're doing reading and you're, learning, addition or
times tables,
multiplication and stuff, right? And you keep blurting out the answer. I mean, not so bad, right? Like, would you expect an 8-year-old to do that?
Yeah.
Maybe, right? And you can only redirect them so many times before that kid's going to think, what? I'm always getting in trouble, right? Now I missed recess because I talked out of turn again and my name's on the board and now it has 2 check marks and so they miss recess. And so what happens then, right? They're even more restless. They're not having any, stimulation.
Yeah.
And the problem just escalates and snowballs into other areas. And that's just, one symptom that could be popping up early on that is, like giving us clues. And I think teachers have their hands full these days. They've got so much on their plate, right?
Yeah.
Like the expectations and parent expectations, and today's information age is pretty wild. So, I think there's a lot of pressure for parents and teachers, schools to have a better handle on how they create the environment that might be adaptive for, and helpful for everybody. So I know we derailed a little bit. You're asking like, what is ADHD? And I'm like, diving
it's
into
okay.
like, hey,
That's
here's
beautiful.
a problem already, right?
Yeah.
But I'd say that's one of the biggest things that I see happen most when parents will bring a child to me. I think on one hand, there's like some stigma of, well, what's going, you know what I mean? Like,
Right.
but by the time they get into psychiatry or get, to their pediatrician or whoever their provider is, that they're, asking about, there's a problem going on, and what is that problem when you're 8 is going to be different than that problem when you're 14 or 27. And it just depends on, well, what's going on in the environment. And so I'd say, I hear parents a lot say, well, why wasn't this a problem when I was a kid? Well, I don't know, because, back when dinosaurs roamed the earth, would that mean, no, I'm kidding.
Yeah.
It was a little bit different, societal expectations.
Yeah. Well, that's actually another question I want to ask you is, do you think ADHD's getting worse, both in terms of symptoms in patient cases and like number total? Or do you think it's more like our environment that's just putting us in situations that are not conducive to people who maybe don't have quite as long of an attention span, or like, what do you think it is?
Well, and I think there's a lot of theories on it, and I don't know the answer to it, but we've discovered like there is a huge genetic component to it. Largely, there's a really high chances if you have a parent with ADHD that I think it's over 50%,
Wow.
odds you'll have it as well. And I like to think, so earlier you asked about my background, and it's funny, like last year I went to, with the last couple of years, I've gone out to South Carolina to see my extended family, and my grandpa, and he's in his 80s now, and he just loves telling stories, right? And he's telling me about all these things. Well, his dad, this is back when school probably wasn't all day long every day. Right. Kids would be expected to go to school and learn some basic stuff, right? And his parents would drop him off at school, and he would beat him home. Like he would not stay in school. He couldn't stay seated. They would tie him to his chair. Like he was like, no, they would tie him to his chair.
Whoa.
And I mean, makes you wonder, right? Like, were they tying all the kids into their chair, or was it just the one kid that was not sit still, that was up, that was disruptive, that, just felt cringe to be there, didn't like it for whatever reason? Well, and then I, as I ask more and more, given my perspective now as, practicing in psychiatry and mental health, I notice patterns, of what's going on. And so I ask more questions, and you just find out, like, holy cow, almost nobody on my mom's side of the family graduated high school.
Wow.
The teenage pregnancy rate is really high in our family, and substance use. I mean, there's just like so many things, right? So my great grandfather, right? That was his story. Then my grandfather, he finished a lot of high school. Him and his brother ended up just starting a machine shop and fixing cars and stuff like that. And they grew up poor. I mean, they were living on plantations and stuff, like, farms, and just trying to survive. Well, then comes like my mom and her sisters, and it's so funny to watch the tendencies of my family. And like, wow, like there's a lot of similarities. None of them like school. I think all of them dropped out early on. They've all since gone and gotten GEDs, and you know what I mean? Like they've made stuff of themselves, and they were hard workers, but you just start to feel like something's wrong with you. Like, oh, what is wrong with me? And they, back in those days, there just wasn't as much information. ADHD has been described like in the literatures back into the late 1700s, 1800s.
Yes. Yeah.
And so it's not something that is just showing up now. It's something that's been present for a very long time, probably forever. And I mean, we've been inheriting it, and I don't know. I mean, different what is that? Skunks attract, or I don't know. Like you'll find your people,
yes,
right? The
yeah,
people
yeah,
that
yeah.
you're
Mm-hmm.
that your compatibilities vibe
Right.
with most.
Like finds like.
Yeah.
Yeah.
I mean, when you have things in common, like, hey, I didn't finish high school either, and
Mm-hmm.
you know, like, and you're working at the same place, and you're like, what are you going to do? You're going to reproduce and make more kids, and then so anyways, Nate comes out into the world and has more kids, and
Yeah.
you know what I mean? Like the story goes on.
Yeah.
So as generations have evolved, and I mean, we're able to recognize it easier. There's a lot of information. You know, we have TikTok telling us exactly what's going on.
Right.
Right. That
100%
like,
of the time with 100%
Yeah.
accuracy. Yeah.
perfect accuracy. And you know, Dr. Google, of
Yep.
course, we love, and I love all those tools. Honestly, like
Right.
I love it when patients bring it up, and they're always embarrassed to say, "Well,
WebMD
I was looking on Google,
Yep.
and I filled out a screener form." Like, oh, right on. Like, what's going on?
Mm-hmm.
So people already know that they're like, what am I dealing with? Not that everybody has to deal with stuff,
Right.
but people want to feel heard when they're struggling.
Mm-hmm.
And I think that people are able to have a voice these days and speak up for themselves. Not all the time, obviously,
Right.
but when they can, I think there's never been more opportunities, at least in my lifetime. I remember my dad saying, yeah, children, you know, when I was a kid, children were to be seen and not heard.
Mm-hmm.
Sometimes I wish that were still kind of the rule of thumb, but
Don't you mostly work with kids?
I have a bunch of kids, and
Yeah.
they're super fun. I wouldn't want them to shut up. So
Yeah.
it's I think it's a bit of everything, right? Like
Yeah.
the world, yeah, we're more populated, but there's also way more information to identify some of the things going on.
Mm-hmm.
So we don't have to suffer or live with the dysfunction and distress that it just causes in people's lives.
Yeah. That's interesting. While you were talking, it occurred to me, I think one of the big differences between the modern age versus previously is we are so observed, right? And not just in the way of like security cameras and your phone's collecting all your data, but like previously, if you like, my mom's one of 8, right? And so they were all doing different things. Both her parents worked, like they couldn't keep track of everybody, and so they're like,
Right.
they'll figure it out, you know? Right? I keep them fed, keep them clothed, keep them alive.
I call
They'll
that
sort it
culture,
out.
right?
Right.
That was their family culture.
Right. And my aunts and uncles are fantastic. But yeah, that was just kind of the mentality. And so if somebody was like struggling in school, it wasn't such a focus, such a discussion. It wasn't going to get named necessarily. It was just like, okay, well, you know, mechanic shop's hiring if you want to do that instead. You know, just whatever you do to like make sure you're providing for yourself and you know not being a
Well, and that's kind of the point, right?
Right.
Is, well, when you were a kid back in your day, you know, back in their day, back in my grandpa's day or parents' day, my day, I mean, those were different days.
Mm-hmm.
The societal expectations has shifted quite a bit. We like people to finish high school these days.
Yes.
We've come up with so many opportunities for people to finish high school.
Mm-hmm.
They don't have to do it in a traditional brick and mortar anymore, right? You can do it online. You can do it in a hybrid way. You can go to vocational training for part of your day and, you know, take some core classes. There are just so many ways to be successful that it fits more individuals. And not to mention like the information that we can just learn on our own. You know, virtually, internet, YouTube. I know remodeling my kitchen, YouTube. I didn't have to go to craftsman school.
Yeah.
You know what I mean?
Yep. Yeah, I do know what you mean. I've been getting really into cars, and actually I was talking to Tim before we started. And he's like, "So like, did your dad teach you?" I was like, "Nah, YouTube.
Yeah.
YouTube University, man."
Heck yeah.
I
love it.
Yeah. So let's talk about like modern symptoms of ADHD in the present day. What does ADHD look like? What are the biggest struggles, especially for kids who have it?
Well, I mean, I don't think it needs to be just limited to kids, because if you've had it when you were a kid, the chances are really high that you're going to deal with it at least to some degree as an adult.
Mm-hmm.
And so if someone does have ADHD or did have ADHD, it's really a matter of like, how are you dealing with it? And, what are the issues that it might be attributing to going on in life? So there's, from a statistical standpoint to function, functional standpoint, I don't like statistics that much because, well, I like statistics because I like to beat statistics. Like overcome the odds.
That's a good reason. Yes.
Overcoming the odds. It's super fun. And it gives me some motivation and drive. That's just my personality. And what it looks like today is going to be different depending on the environment. So what it was like when my mom was young looks a lot like it did, but they were still able to get by, function, get jobs, get education, survive. Is that as likely these days? No, everything's so much more expensive. It's so much more complex. We can't fix our own cars hardly because of the complexity of the electronics and the computer systems and availability of parts, that are so specific. And so as our world has become increasingly like complex, just because we can't, I really don't know how to say it other than if it's persistently causing a problem in your functioning, whether you're trying to go to school in a class, there could be something going on. I mean, it could be, and so with ADHD, it's something that's causing persistent or invasive problems in your life, whether it's academically, occupationally, socially, and you're functioning to, a large degree within at least two of those areas, because ADHD isn't just an academic problem.
Right.
There's consequences of it when we don't pay attention, when our friends are talking to us and they think we're ignoring them and now we don't have any friends, or because we're disruptive and interrupting people. And there's like, man, I'm always feeling like I'm shut down. Right. You know what I mean? It causes the social problems, and the results of that, reduce your network opportunities and so forth. So if it's causing problems there, what would it do to a marriage? Right? When you first start is so exciting when you're dating, and if you have ADHD, maybe you're impulsive and spontaneous and you choose to just go camping because it's Friday and the weather's great, right?
Yep.
And then when you're married and you're boring and dull and not, interesting anymore all of a sudden. Yeah. I mean, that can cause a lot of problems that we just don't realize are, I dealt with it when I was a kid, but now it doesn't cause problems in my life. I find that to be rare.
Yeah. That's interesting. That's something like, I'll just be totally honest. Abby and I are engaged, and that's something we're working on right now. Is like, it used to be like, oh, let's just like, hey, there's a jazz spot, in Phoenix. Let's just go check it out. And now we're like, we can spend exactly $98.36 this month on outside activities, and then the rest needs to go towards like the house fund. You know what I mean? And so, yeah, it definitely does. It makes it different for everyone, but I think especially like for people with ADHD, and really that goes back to, Dr. Burton brought this up last week. We were talking about what does it mean to have a disorder, and the difference between a disorder versus just a quirk, right? Is, does it impact your life? And I think maybe a good example is like double jointed. If you're double jointed, that's not a disorder. If you're just double jointed and it's like a cool party trick, right? Yeah. Like I can dislocate my shoulder. It's not a big deal. It's not, but if it's impacting your life, if it's resulting in negative outcomes with your relationships, with your communication, with your work, with your ability to pursue just life itself, that's the kicker.
Yeah.
So
so that makes a good case for, well, this kid or adult, right, that has dealt with this for so many years is, well, I've dealt with it for 30 years. Why do I need to go figure it out now? I don't know. I mean, I don't know your story.
Right.
But you don't have to keep repeating the same, dealing with the same things over and over. Sometimes just identifying what's going on and having it like oh, you know what? Things start clicking. Oh, because I deal with this impulsivity and poor time management and organizing. Well, maybe I need to develop some tools in my life, you know what I mean, that can help keep me on the track with my budget. And maybe I can find some, coaching, or there's apps out there. There are things where we can identify some of those areas in our life where, hey, this is causing the biggest problems over here. And here are some ways and strategies that I can manage and just make a big impact. We don't have to keep living the same miserable experiences over and over.
Yeah.
I think there's a thing, and I haven't looked it up, but there's always slang, but they call it an ADHD tax. You ever heard that?
Yeah.
The tax,
Yeah.
that, unseen,
Yep.
It's not
It's a
official.
phantom tax. Yep.
But, you get more speeding tickets.
Yep.
Because you're running late, and you know what I mean? Like,
Yeah.
there's just like all these extra
So
costs
funny. Yes.
to having it. And, where does that result? And so back to where, like, if you're a kid and your experience is, sit down, shut up, like, you're going to develop something. You're going to develop some defense mechanisms to, like, protect yourself from feeling so bad, or anxiety, like, I'm not good enough, and you'll never be good enough, but you might overcompensate in some areas too. And that's, we're humans, we're adaptable, and we can adapt in different ways. Maladaptive, learning bad habits and bad ways to manage, but we get by, or adaptable, where we can have ADHD and still be very functional, very effective, and, have things ironed out in a way that we can manage well. And so learning those traits for, what I mean, our individual self, what works for us doesn't necessarily work for the next. And you can have two kids in the same class dealing with ADHD that just have completely different perspectives of what's going on. And that's okay. I mean, that's why it's so individualized. That's why TikTok doesn't always hit the nail on the head, but sometimes it does. And why it's important to work with a professional to just even identify what's going on, because there could be a number of other things happening as well.
Yeah, I like that you talked about adults. I remember like 3.5 years ago or so when I started here, early on, I started doing like administering all the ADHD testing at this clinic. I loved it. There was a time when me and one other person did over 50% of the tests in a month for the entire practice.
Nice.
Yeah. And oh man, those were different days. But I remember one of the first ones they did. We did the test, printed out the results, handed it to him, and as you know, especially with the old testing system, the results are mostly like statistics. Yeah. They're not an easy read. You can't really decipher without going to talk to your provider about what it's saying, exactly what's going on. But for whatever reason, I gave it to him, and he looked at it for a few minutes, and his face just like knew. And I just saw the like wave of realization hit him, for this person who was like, had to be 55 maybe, just like, I felt like I could see his entire life getting changed in the back of his head as he realized.
It changes everything.
Yeah, it was a big moment. It was very interesting to me, which is one of the reasons why I fell in love with doing the test, and administering it, I should say. Yeah, ADHD in adults, I think, is a very under discussed problem. Emery Casey, who's on recently, we talked about it as well, because she deals with postpartum. She's like, yeah, I have moms come in all the time, and they come in for postpartum depression, and they get an ADHD diagnosis, and they're like, what? But that's what the underlying issue was. So
Right. Well, and you feel like you just develop those thought habits, right? Well,
right.
I'm not getting anything done, right? And when we tell ourselves what we tell ourselves and the things that we say to ourselves the most are the things that happen.
Mm-hmm.
So do we get more done because we say we don't ever get anything done? Probably not.
Yes. Yeah. So let's talk a little bit more about treatment options. This is one of my favorite parts about you and Redemption Psychiatry as a whole is you're a PMHNP. So you do medication management, but if somebody's going to sit down and do an intake with you and is diagnosed with ADHD, that's not necessarily the first thing that's going to come up. So what do you recommend to patients, and what are treatment options for ADHD? What do you talk to patients about?
So the first thing is helping identify, like, okay, here are the symptoms going on, right? They're just telling you all this stuff, right? When you're doing an intake, it's comprehensive. You want to know about anxieties and stressors and sleep and medical stuff going on. And you want to know about education, track and how things gone with occupation and how many jobs have you had, marriages, all sorts of stuff, right? Because it helps you understand from a clinically or like in the real world, where's the problem in your life? Is the problem that you can't get out of bed, and you're missing a lot of work, and then you get fired, and you're not getting anything done because you just have no energy and you're not interested in doing things well, if that's the problem, right, we're gonna sift through and kind of like, okay, that's going on. What else? What happened before that started causing new problems? Because that sounds like it could be depression, right? And well, you can have both. And, so what do I try to help them do is like reflect, like what's been going on really, and where's that really coming from? Is there something that's been happening all along, or is this something new? Is there something that you've just managed better and now you're not? And just identifying and trying to pinpoint, like, is there something specific that's going on, and looking at, hey, how do we approach this? Is it we need to work with therapists, or to be able to identify ways to cope when our feelings get hurt, which it turned into an anxiety or a social situation? Or is it we need to consider just lifestyle changes, the things we eat and the things we do to keep ourselves healthy, or are we trying? Do we care? I don't care. Why don't you care? That's actually why I started doing psychiatry. I was doing critical care in ICU and cardiovascular ICU and stuff, and trauma ICU.
Oh, wow.
It was super fun. And I loved the adrenaline, and I loved.
That's great. Yeah, it's all trauma. Super fun.
Well, yeah, funny, right?
You're not the first person who's done that too. That's so funny.
Well, you tend to gravitate towards your people, right?
Yeah.
And it was a good vibe. It's like super fun. I loved doing that stuff, and I didn't think I'd ever leave it. And so naturally, I thought, what, I'll probably, when I do advanced practice, when I do nurse practitioner someday, I don't know if I could ever work in a clinic, an outpatient clinic, and, treat UTIs or something. I don't know. I mean, in my mind at the time, I thought like, boring vaccines and, stuff like that. Well, I took care of enough trauma, like post-recovery, cardiac surgery, that I thought I was doing I was like, this is just so rewarding. I don't know that I could ever do anything different. And then as the years went on, I realized how, like, am I actually saving anybody here? Like, this going to be the same pattern? This guy is not going to change his life. This kid, how could someone have ever stepped in, to prevent them from getting behind the wheel, after drinking at a party, or, the consequences of decisions that were made along the way. And that's really what led me to mental health. Is I was like, I wonder if I could make a difference in someone's life before they started having like devastating consequences. If that would make a bigger difference in the world, not just, treating something that's already broke. And so the treatment options just depends on where you're at and what's going on and where you want to go. Like what were your goals? What did you want to do that you're not able to do now? And I like to present people with, and it depends. Like if you're a kids, I mean, you have to approach things different, depends on the context, right? If they're homeschooled, I've seen a lot of kids that are like homeschooled and their environment is as such to where it's not a problem, right? They've got a lot of time perhaps, and their parents, are like, hey, we do a subject and we jump on the trampoline and go to, to the store, and then we come back and do another subject, right? So it's just not all constant, in class work. That's, the expectation of the environment is conducive to learning and growing, right? So does that kid need medication? Well, maybe not. And maybe they can build in some strategies like that, but that's not possible for everybody. Right. And so if you're in an environment or, your family members in an environment that's not so conducive to taking frequent, walk breaks or getting up and stretching your legs or sharpening your pencil over and over and over, or, if it's causing disruptive in the environment, then that's going to lead to more problems. And so are we planning to stay in that environment? Is it possible to make changes? Is it possible to give accommodations? For an adult, it could be very much the same. Or, I mean, this is where you love working here. You don't want to lose your job again, or you don't want to, right. Miss a promotion or progress that you wanted to take because does that mean, what do we have to change? What's going on? Are you exercising? Are you trying to make, And so if you diagnose ADHD, giving them options that are treatment options are good. And I like to start with like lifestyle, environmental factors, like what can change in the environment that might be helpful. They used to, it's not as common anymore, and there's less evidence for it of like foods to avoid.
It's the sugar.
Yeah, sugar. Yeah. Obviously, right? Like these days, I mean, you want to try to do good nutritional things. If you have a spike in blood sugar and energy and then you crash, I mean, unless you're, I don't know, I probably can't find good evidence to support that as a healthy diet. It's just preached all over the place, well balanced and reducing sugar, reducing food dyes, those kind of things. But that's not, if it works, great. Usually those people don't show up, to the clinic for evaluations, because it's not causing a problem. They've solved it. They're taking care of it. They're managing whatever is going on. And if someone's dealing with, I mean, I have patients a lot of times, this is like a common scenario, is where they're adults, they're professionals, they've done well, they've, graduated college, they're working, they're successful, right? And I'm like, well, what's going on now? Well, they've had a knee injury and they can't run anymore. They're not doing marathons anymore. They're not training. They've lost their ability for that physical outlet. I'm like, okay, so what's going on? Now they're having a hard time with focusing. They're feeling defeated. You know what I mean? They're down about it. They're stressed out about it. They can't sleep well. It just cascades into a whole bunch of other problems. And they'd been managing ADHD, over those years with environmental modifications that they could make. Those were adaptive, right? And exercise and those kind of things that were working well for them. But now, they're not, and it's causing more problems. And so is medication appropriate? Could be. And so we talk about those things as well. It's like, well, there's medication options, and we have to decide if is that what we do first? I would say if you're making environmental modifications, you're trying the other stuff. Medication will help with focus, and focus helps everything. Right. The interventions you're trying to do will go further. The apps you're trying to use to develop new habits will go further. Your budget will you'll be successful because you were able to resist, you know what I mean? Like you were focused on the goals and not getting distracted along the way the whole time, and, you know, feeling bad and guilty and reset, you know, every few weeks.
Yeah, that's so interesting. And I know there's at least some literature. I was talking to Andrew Lyons about it the other day, about how the effects of ADHD medications there's some residual effect, right? Even after they're gone and out of the system, patients will be improved from before they've taken it. And from both my personal experience and my experience here at Redemption Psychiatry, I think one of the reasons is because in order to... a lot of people, they need the focus to build the infrastructure, right, to make the life changes, to not need it anymore, right? And so whether that's getting up early and going for a walk, or keeping a journal, habit formation really is, it's like I've seen really, really effective use, especially of short-term medication for habit building, and then afterwards they get off the medication and it's their habits and lifestyle changes that just carry them through, and they do so phenomenally well, which is really cool.
Yeah, and that's a lot of times parents, that's a big concern, right? Are they going to have to take medicine forever?
Right.
I don't know. You know, are they going to have ADHD forever? Probably. There's a high likelihood that it's going to roll over into adulthood after your nervous system's, you know, full brain development and stuff. But the work you do is going to be what determines whether medication is, you know, more chances or not. So what are we talking about? Are you talking about like, okay, we're willing to work with an ADHD coach or a therapist, or do, you know, these work on strategies to manage it while we're taking medicine or in addition to medication? And there's a time and a place. And that's essentially what the point is there's a time and a place for everything. I mean, I'm not going to try to get this guy with a busted knee to, you know, I'm not a physical therapist. I'm not getting him back onto the course to treat his ADHD. It's like, what do we need to do now to get your functioning back to where your, you know, symptoms are managed well, and your confidence, or, you know, your mood, stresses, anxieties can improve those periphery symptoms.
Hey guys, Redemption Psychiatry is a private practice in Arizona that made this whole video possible. If you or a loved one is in need of mental health services, please feel free to give us a call today. Let's get back to the video. Let's talk about, I want to kind of jump back. We talked a little bit earlier about other symptoms, how, like, you talked about depression earlier. Let's talk about ADHD and co-occurring disorders. I know we talked before we turned the cameras on about how we started doing React videos because people who I think are good intentioned, and I never like to criticize people, but people will post videos and it'll be like, how to know if you have ADHD, and it's wrong. It's just wrong. Totally not.
If you're fun, you're probably having
ADHD, right? Yeah, right. Did you forget the milk at the store? ADHD, guaranteed, right? And that's obviously not how you do it. And I think another big element is because there's so many co-occurring disorders, there's a lot to sort out, and sort of that the chicken or the egg problem, right? Like, if you have depression and ADHD, well, is my feelings of worthlessness, my inability to get out of bed, my self-doubt, is that causing inattention? Or is my chronic inability to keep attention to succeed in life causing feelings of worthlessness and self-doubt?
Exactly. And that's why so for diagnosing ADHD properly, having a clinical interview, that's the gold standard, is the clinical interview.
Right.
And that is what's going on from a comprehensive perspective, right? It's causing problems. When did it start? You know what I mean? How are things evolving? What's helping? What's making it worse? And separating that out, sometimes you can't. I mean, when you scramble an egg, can you unscramble it? Maybe not. I mean, I guess no, you can't.
Yeah.
But fortunately, with treating, you don't. Okay, so let's say you have both, right? It's like, well, we know you're definitely dealing with depression, and it's severe. There has to be a prioritization of the approach, right? Yeah, the ADHD, maybe it's happening, but you know what? Let's put that to the side for a minute and view the concentration problems. You were functional, you were keeping the job, right? Like things were going fine until you couldn't make it to work because anxiety became so bad, or because you just didn't have the energy or motivation to do it anymore. And mood is always priority. You've got to treat the mood, or the other stuff is going to be just like muddying the water and, trying to see what's on the bottom. So treating the mood and then reevaluate, for, okay, what's left.
Right. Yeah. That's, when we do testing here, so I'm obviously not a medical professional, but the testing stuff falls under my department, my team, and I'm a huge statistics nut. So I really love breaking through and seeing how, those tests work, how they pull data, how they organize it. And so sometimes I'll talk to providers about, well, what's the test saying? And one of the most common questions I get is are there good indicators to know that this is anxiety versus ADHD, right? Because anxiousness, doubt, that's going to cause a lot of similar symptoms. Like one of the things we look at in the test is reaction time variance, right? So are people taking a really long time to answer, or are they sporadic, answering fast and then taking a long time? And if you have anxiety, you can freeze up and you'll respond in ways that are atypical, and pulling those out from, atypical ADHD responses is tricky. And it really, it goes back to the provider just knowing the patient and knowing through diagnostic interview what's going on. So
that's one of those things we don't realize we self-medicate, right? Like the example of the individuals coming in that have very successful, they're using exercise and, different things for managing, things they didn't realize were underlying going on, and it's effective. But we don't realize that it's like, if we're in a state of like a mini panic disorder all the time, we're having a fight or flight, our hyper arousal neurochemicals are keeping us more vigilant.
Right.
It's keeping us, and so that's what
makes it really hard to read a book.
Yes. Right. When the situation's boring. So what do people do? Well, they might wait until the last minute. And then fly through the book as fast as they can. And then
the fear of one overcomes the fear of the other. Yeah.
I can remember those days.
You're describing high school me way too well.
Well, and it's those little subtle things, because people, they feel, weird about asking, like, I think I have ADHD. Okay, what's going on? And it almost sounds like sometimes people will be like, they'll just read you, 1 through 9 of the first criteria in the
from
DSM.
The manual. Yeah.
Like, did you memorize that? Like, I want to hear about your life, like what's going on in life,
right?
Not what the criteria is. And that's the purpose of the clinical interview as well, is like, what's going on? Like, how is this affecting you? I know what the criteria is. And so, if you're having to stress out, you don't realize at a certain point that that's what you're doing. You don't realize that your poor time management is being managed by stress to keep you, effective, functional, but that takes a toll, doesn't it? Kind of the same as self-medicating with something else, a substance or something that, just kind of makes you have some perspective of, well, why is that so bad? Why is that such a issue? Well, if you want to have high blood pressure and, heart attacks, or get more speeding tickets because you're rushing, and it's okay. Like, no one's judging you. Like, it's more of like, hey, here's what's going on.
Yeah.
But what can you do to make those changes so your quality of life is better, or your effectiveness is dialed in?
Yeah. That's interesting. And that kind of goes back to, I think, medication a little bit, right? Is like I was talking to a patient a while back and they were discussing side effects of stimulants, right? Which are absolutely valid and absolutely there. And some of them are cardiovascular, right? And so one of the questions you have to ask is, well, okay, is my risk of heart problems from medication as bad as the life that I'm creating for myself, which is high stress because I can't focus? And so it's a strange duality, and it really goes back to, I think, what you were talking about earlier, where it's like, well, what's actually going to be the best thing for you?
Right. And that's a good question. There's pros and cons of everything. There's consequences, potential hazards of not treating ADHD.
Right.
The same thing with anxiety, but there's also potential pros and cons of treating it. Mm-hmm. If I go to therapy, what's the potential consequence? Well, it's going to cost money. It's going to take time. Mm-hmm. I'm going to have to, open up some feelings and talk and, experience whatever that uncomfortable, whatever we're worried about, in that aspect. And maybe we're going to open up some things we weren't, like there's potential risk of us, feeling a little worse because we're trying to walk back through it and deal with it rather than, keep stuffing it away. Mm-hmm. But is that going to be better than healing from it and being able to move on, a memory on the shelf instead of something that we experience every time we think of it? From an anxiety standpoint, and from an ADHD standpoint, same, right? Like if we're choosing medication, there's potential risks, and we have to be realistic about the managing expectations.
Right.
And in today's world, like things go fast, and when we're doing like an evaluation and we talk about these different options after we've clarified as much as we can for like the diagnosis, and I've had to kind of be mindful and tailor some of the interviews or some of the education of like, hey, here's how we do this, and it's interesting sometimes where parents will be like, I just don't think it's helping. It's not doing anything. I'm like, oh, like what's not going on? Well, they're rowdy in the morning. I'm always yelling at them to get their shoes on, and we run late, and they go to school or whatever, and they get home and they're still, running amok and, disobeying, and they won't listen and they won't clean up, and I'm just having to redirect them all the time. And it'd be easy to right then say like, oh yeah, clearly it's not doing anything. Well, what's happening in the middle of the day? They haven't gotten any calls from the teacher. Like, have you still been getting, emails or calls every day? Because no, well, they must be doing better at school a little bit or something. Right. And so the education of like, well, maybe the timing is off, where your vantage point and your experience with your child is when the medicine's not helping and they're having that experience at home. Yeah, that's not changed. And then when they get home, it's worn off and they're having the same experiences on that side of the, you know what I mean?
Right.
Where we have to make sure that it's improving. And some parents, they don't want to do medication on weekends, for instance, or summer breaks. And really they don't ever get a visual of like, how are they at home when they've taken medication? Well, they don't need it at home because they're not having to learn math or whatever. Yeah. Which that goes back to, the part of the reason for the diagnosis is it's causing problems in multiple areas, it's not just an academic problem. You might be a slow reader or be behind, and that can be its own thing if it's not causing, problems socially or in the family or functionally, in different areas outside of one environment, then it's probably a disorder of that thing specific, like a learning disorder, which is comorbid. You'd ask about comorbidities earlier. Yeah.
Yeah, it's interesting. I think also, like, I'm curious about your opinion on this. To some extent, especially with younger people with kids and teens, and you're a parent as well, So is there some delineation, some difference between, oh yeah, it's symptomology, or like, well, they're being a stinker because they're just kind of at the stinker age.
Yeah.
It's just how it goes, you know?
Well, and that's a lot of times we don't know. We don't know because we didn't get the, how to be a parent handbook. Maybe
Right.
there is one, and we need to,
Yeah.
if they don't have one for dummies, we need to make that for me.
Yeah.
Like, who knows how to be a parent until you've practiced, right?
Right.
And for a kid, like, is it expected that they know how to read, lengthy novels when they're in first grade? Or is it, something different? What's the expectation of development? And usually that can be filtered out pretty good. Whether they're in preschool or school, are they the exception, or of a couple of people that are the exception in that classroom environment? And having, you can be a stinker whether you have ADHD or not.
Yeah.
And that
Stinker's not in the DSM yet.
Nah. And fortunately, well, not fortunate. If it's not causing a problem somewhere, right? Let's say you lived remote and you were kind of isolated out on a ranch somewhere. Well, they're just a stinker. Like it's, if they have ADHD, it's going to be more than they're just a boy, because you're accepting that, like, that's taking the stance of like, hey, I used to do that. That's fine. That's not causing problems. Well, if they're doing that same thing in a classroom, is it causing a problem? And if it is, that's a problem, and that's going to cause more problems, right? I'm going to hate school, or I'm going to, develop these beliefs of, things are bad, or people hate me because they tell me to sit down all the time. But if you don't have that experience or context of comparing, with other same age, gender, children,
Right.
it becomes, you're not comparing apples to apples. So we've got to compare apples to apples. I should have said that instead of just talking about something.
No, you're good.
Didn't get there.
Yeah. Yeah, it's so interesting to me because one of the things that I think is a really big question right now is, well, what about, like, how much should children be playing? And so when I did my master's in work psych, one of the things that I learned about and that I did a little bit of research on was, well, what's the value of incorporating play into adult work, right? And so, for example, competition. This is a great example. We implemented this here at Redemption Psychiatry. So staff who, we have some ethics guidelines for how to do it, but staff who get Google reviews with their names on them get points that end up resulting in prizes. And, you can't, you have to do it by being a decent employee and not by like, oh, mom, leave a Google review, right? Like, there's some standards there, but it's great, and it makes people excited and a little bit competitive in a good way. And it's something that we pulled from work psychology that we implement here that works really well. And if you look at, mammals in general are very play oriented, right? Even as adults, and kids especially. And if you look at the difference between human children, between girls and boys, because ADHD is not a boy disorder, but I feel like it's often thought of as one. And part of it's because girl play and boy play is very different, right? Girl play is much more likely to be social and play pretend, right? House, right? I remember as a kid, like, my sisters would try to get me to play house. And I was like, I want to have a sword fight. What are you talking about? Versus boys tend to have, they like to play wrestle, right? They like one of my favorite things is when, like, dads throw their little kids around and the kid's just giggling and getting whipped around like a nunchuck, and he's just having a great time. And so I think it's important, like, we're not trying, the goal for parents isn't to reduce play. You can't, that's so important to a child's development. And so I think really the question is, like, how do you manage that? Because you have this, like, in school, school's not a play environment for sure. And I think sometimes what we've categorized as stinker symptoms is play seeking, right? And it's kids who are just trying to actually do what their brains are urging them to do to develop.
Yeah.
So.
And thinking of like, what did I like to play? Whenever I was around like family or cousins and stuff, and they wanted to play house, I always wanted to be the dog. For some reason. Isn't that weird?
That might be a little weird. Why is that the case?
I have no idea. I loved dogs.
Yeah.
I still love dogs.
Great. Me too.
But yeah, it was super funny. When you said that, I was like, what did I want to be? I wanted to be the dog. I remember that. Maybe, I have no idea.
You could just go run around. Yeah.
It was a good question because, well, if we want to, there's natural tendencies of us in development, right? Like we're going to be able to connect, from different developmental stages to the next. And it's not going to all happen, just like simultaneously with everybody in the class, for instance. But yeah, there's been less and less opportunities for physical outlets, with higher academic standards or demands being required, and put on the teachers, right? So they've got to teach more and instruct more with less. And I'd say not even relatively less. It almost seems like there's higher expectations and there's a lot more demands, but they get even less than they used to. They've cut music programs from schools and they've cut, PEs and things like that. And some of them still have it to a degree, but it's not like it used to be. And yeah, that's a good question. What does that do for development, brain development, ADHD, especially, right? Like I used the example of a boy that gets his name put on the board and check mark next to it. And this is a way to like, hey, mind your manners, or you're not going to get recess. And he misses recess. Now what? Well, now he's just even more locked up and tense and frustrated, and emotions are dysregulated because he's going to learn. What is he going to learn from that? It's not because he's choosing to be a turkey. He can't control it. It's neurochemicals in the prefrontal cortex of our brain regulates, decision making, planning, organizing. Impulse control is, it's frustrating for teachers and bosses or in meetings where people are expected to be attentive, paying attention, contributing, critical thinking, and, someone starts talking about something that's irrelevant or, interrupting important discussions, or they're just anxious to even participate because they don't want to look like a fool. And they've developed that trait over the years because that's protected them and served them best.
So one other thing I want to ask you is parents are always asking us for resources, right? This is like my team, we spend a lot of time building just like referral lists of like where to go to therapy, who have we worked with in the past that we know is really great and really cares about their patients. So one thing that I think would be really useful is kind of walking us through what are like the treatment options and what vague order, because it'll be different for different people.
Right.
Should you pursue them, right? What do you do first?
Yeah. So we'd try to address the symptoms, right? So what are the symptoms? Where are they going on? Yeah. The psych provider can help us, decide the options and the best course. If someone's in child age range or even adolescent, starting with therapy, the school, counselors, and identifying and knowing that you're dealing with it in the first place is always going to be huge, because it's such a weight off your shoulders knowing that, okay, I've got something going on and that we can work with, right? And same for parents, like just some relief, like, okay, we know they deal with ADHD. do we got appropriate accommodations at school? Is there something that, would it help if they were able to have more time for their reading assignments or in an environment change, right? So addressing the environmental factors if possible. The other treatment options, I'd say looking at, is medication, is it necessary? Is it not just indicated, but are we at that point? And I'm saying that like as a question is like, if we're at that point, almost all parents are going to question it unless they already have experience with, other of their kids that have been on medicine or something. But I like the analogy of, well, we have a vision problem and we're going to try some vision therapy and some exercises for a couple of years, and then we'll try glasses.
Right.
Does that make sense?
Yeah.
I mean, who's going
to,
yeah.
Like, first, let's just eat more carrots.
Yeah.
And then if the carrots don't work.
Right.
Right.
And so I know that, I come from a bias as a parent. I would prefer that my kids didn't have to take medication, but honestly, they work so good that I would consider that as part of the treatment. And the more of the therapy part that you do, whether it's, with an occupational therapist working on sensory issues from the overstimulation or from, working on organizing and keeping yourself on task from different strategies, I think those are golden. I think the more you do at once, there's a statistic, I don't know exactly what it is, but if like it's for depression specifically, but if you treat depression with medication, the effectiveness, it's effective for about 60% of the time. Right. And if you treat depression with therapy, it's, you've got similar statistics. It can be as effective, but if you combine the two, you get a way more robust effect. And if someone wants treatment, you get a way more robust response, right? Like it's a big impact. The more you do and the heavier you hit it, the more you're going to be able to manage it and control it. So I don't think holding back on any of it, especially if we've been working on things, or if you're an adult, right? Like what are the key treatment options? Well, can you exercise? Will you exercise? Can you work on some organization skills? Will you work on organization skills? Do we even acknowledge that there's a problem, or is it our spouse, making us go get an evaluation and talk about it? Like it depends on where you're at, but medication can work really well if it's indicated and, determined to be a safe option, and doing therapy to some degree. And it could even include like self-help videos, workbooks, online therapists, in-person, therapists. I've worked with some professionals in the medical field, like a pharmacist, for instance, and didn't know he had ADHD for a long time until his wife was like, we've got to figure something out. Right. Which you hate for something to get to that point ever. Right. And maybe it wasn't to the point where, they were talking divorce or anything, but it was, this sucks for me, from the partner's perspective, they were able to talk about it and communicate about it. Right. So they evaluated and, they started medication, and he's smart. He's very smart, still smart. But the things he has noticed is like my interactions with people are just so much more. I don't avoid, and it's easier for me to slow down what I'm doing or transition and shift gears from, the rigor of my job to taking it in and working with people instead of just doing work. And so I think treatment comes in all shapes and sizes, and tailoring it to what works best for you is going to be the best option. I don't necessarily think people need to take ADHD medication every single day, especially if it's a stimulant, but there are some medications that aren't stimulants for ADHD that you do have to take every day for them to, maintain balance in your,
Right.
in your system.
Guanfacine. Yeah.
Yeah, guanfacine, Strattera, Quilbree, and Wellbutrin is an off-label. We use that one as well. And those can be effective and helpful to take the edge off sometimes. It depends on what the situation is, and what makes sense. And that's why, working with somebody if you identify it, awesome. Now what, right? Therapy, self-help, listening to podcasts, listening to like what are common experiences. My favorite, and I have a lot of favorites, but one of my favorites is a podcast called Faster Than Normal. And Peter Shankman, he wrote a book, and it is hilarious how he describes what people with ADHD experience in just such a raw way where it's just like so funny. You're like, are you kidding me? And how he wrote that book fascinates me, because he knew he wanted to write it, but he's just not super organized, and his brain, you know what I mean? Like there's so many distractions and he gets derailed. So he booked a flight to Japan. I want to say it's Japan. Overseas. It was super long flight, and he wrote the book on the way there and the way back because he couldn't get up and leave. You can only get to the bathroom so many times, right?
Trapped.
Yeah. And so he could just hyper focus. So ADHD also, you have superpowers. And if you can learn how to harness those and use them, is like Peter Shankman's a great example, right? He identified where can I make the most impact and utilize what I have and make something that's productive out of it. We need all shapes and sizes. Like it's okay if you're hyper, if your kid's a turkey, or, like we'll just say it's, if we're, not everybody has to fit in the same mold. Like, we want to keep kids busy. We want to keep them active, but we don't need to keep them overwhelmed. And it's easy to get overwhelmed if you have too much or too little to do, with ADHD. And that's where problems arise. Yeah.
Yeah, it's interesting. I like to think of it as like, take it as like being sick, right? Like if you've got a head cold, you might really just need some water, That might be the best. But if you've got like a bacterial infection, right? Well, if you don't take any antibiotics and you go out and eat gas station sushi every night with this, and then you run around super stressed all day, it's probably going to take a long time to get better, right?
Yeah.
And if you add, this is you talking about therapy and medication together, so it made me thought of this. It's like, well, if you do the lifestyle changes and you're like, okay, well, I'm not going to eat certain foods for a while, and I'm going to do this and that, that's great. And if you take the antibiotics, that's great. But it's when you do all of them together that you get better in days instead of weeks.
Yeah.
Right. And especially like when you do the bare minimum, you actually, antibiotics like this, you have a risk of having the opposite effect where you just get used to doing it and you don't actually even get better. So yeah, treatment's very interesting, especially for ADHD.
And it's not that there's going to be cultural preferences. There's going to be individual preferences. It might vary from region to region where you're at. What access to therapists, for instance, like therapists are busy, especially if you're a good therapist or, specialize in something, and it might be a wait list to get on. Right. And people need things to turn around now. Like I need to keep my job. I need to pass this semester.
Yeah.
Like things are on the line, and I've been doing what I can, but I can't anymore. And that's where medication can rise in some occasions, but if it's for something like depression, ketamine might be a better option to keep your functioning, for these next few weeks while we, work on the next things that we can get to. But for now, let's keep you out of the hospital.
Right.
And with ADHD, could be very similar, but it's a lifelong thing. And so it doesn't mean that we need to just we need ADHD medication. I need it now because I have finals next week. It's how are we going to manage this overall?
Right.
Exercise and medication, therapy and medicine, exercise and therapy. Like, can we take medication out of the equation? And that's what I like to challenge people to consider. Like, what are we doing? What are you doing with life different? How is this changing your life? And how are you changing your life so you can be reliant on what you've learned to do and manage on your own.
Mm-hmm.
At least that's what most people would desire to do. And if they don't, that's fine too. Like there's some people have really put in a lot of work with therapy and exercise, and they do all those things and they take medication and they still hang on by a thread, it seems. And that's okay.
Mm-hmm.
That's why we're here, right? Is to stay on top of it, keep it managed and adequately controlled. There's a lot of good opportunities, and I don't want to omit any, possible treatments for ADHD. So we talked about environmental factors, environmental modification, and trying to change strategies on how maybe we're approaching things, and like a school day or work day, or what can I do to change my functioning? We talked about therapy, whether it's like psychotherapy, working on like, how's this affecting us? What are my thoughts about it? How do I want to think about it? How do I want to change, the way I believe this is going on? Or, what problems has it caused in my life, and reflecting and trying to heal from some of those things. And how do I manage effectively? How do I cope? What are some good, adaptive coping strategies? Working with therapists or occupational therapists, right? Different therapy persuasions, I call them, but they're all really good.
Mm-hmm.
And then there's other complementary or alternates, right? Like supplements. And I don't know a whole lot about those, to be honest. I think that it's hard because not all of it's very regulated, and
right.
it can be inconsistent, and the results can be inconsistent. For instance, I have a psychology prescribing guide for kids, with children and adolescents, and in it talks about saffron being a good supplement, and they've done head-to-head studies with Ritalin, and how parent reports of behaviors and teacher reports of behaviors were significantly improved, and even comparable to the kids that were in the trial with Ritalin. And that's awesome, but it doesn't work for everybody. And so can I prescribe that or recommend it? Like, I can recommend it, but I usually direct them to a website or something that has those resources or information on it. And there's like omega-3s, fish oil. Yeah, those are good. Those are supplements. Those are good. And if they're helpful, awesome. I can't really say much about caffeine. I mean, caffeine's a huge, it's a stimulant. It's in and out of your system fairly quick, but we tend to adapt to it pretty quick. And it can be used medicinally, for alertness during testing and stuff, if we're doing it just as that. But if we're drinking it every day, it's less effective for maybe the times that we need to be more
right. 5 cups
more
a day.
attentive. Yeah. And so outside of that, there's neurofeedback, where you have an EEG and monitor those brain pathways, and you work with a therapist on strengthening those pathways. And it's an effective treatment. It's repetitive. You got to do a lot of sessions to do that, but it's been shown to be effective. And there's newer, they need more studies for this, but it's like digital, I can't remember what we call it, in the field.
Oh, the games?
But yeah, it's like games that also, helps strengthen some of those cognitive functions, whether it's visual-spatial memory or staying on task, on the task at hand, right? There's games that have been designed to keep us interested and motivated to do them, 30 minutes a day for weeks on end.
Yeah.
But that,
it's school could have been a video
positive
game.
Results, right? Like, so there's promising treatments that aren't just medication or just, therapy. Yeah. Another one that I find, this is my favorite one, and I think I really hope this evolves in our country, is Dr. Friday. When we were doing training with him, he talked about how he went to a TMS seminar, and he was with a psychiatrist, I want to say Japan, and he can correct me, but they're doing stimulation on the parts of our brain, the prefrontal cortex, right? And the psychiatrist asked, well, how do you put more TMS machines in your office. And the people were like, well, how many do you have? He's like, oh, I have 30, but I would have 60 if I had room. And they were like, what are you doing? And he's treating
the cognitive
ADHD,
protocols. Yes.
Yeah. Treating ADHD on people's lunch breaks, right? Because culturally, they like in Japan, they're very, very hard workers. They've got great work ethic. That doesn't mean they don't have ADHD.
Right.
And that doesn't mean that they're, cognitive, problems with their functioning doesn't cause problems in their life or in their job. But that's been shown to be an effective treatment as well. But there's a convenience factor and, availability to resources and so forth. But those are evolving and up and coming, in my opinion.
Yeah, I'm so interested in this. So we have talked about doing a study, partnering with the school here in Arizona and doing a study on the effectiveness of TMS and ADHD. And I'm on that team, so I've looked at a ton of research about it. And yeah, it's so interesting. One of the problems is the people are trying multiple different protocols, right? Excitatory right and left, inhibitory left, excitatory right, vice versa, to figure out, well, what's improving symptoms. And the big problem is study size is we had 7 patients. Okay. And so, or 7 participants, I should say. And so it's like, it's hard to tell. And you also have criteria, right? So for example, if you're affecting frontal lobe, you'd expect it to improve inattention. But if you have a patient that's primarily hyperactive, I don't know if you'd see a symptom decrease. So there's all these really good questions, but this is something that is coming up in clinical research that I absolutely adore. I'm so excited about, because if we can prove that it works and that it's really benefiting patients, we'll be offering it here ASAP, because it's a great treatment. It's not medication.
Right.
Really, really cool stuff.
Right. Yeah. And so I'm super excited about that as well. Like I wouldn't hold back. I mean, if there's opportunities for addressing ADHD symptoms, I'd say the biggest problem would be ignoring it and pretending it's not going on, because that leads to so many other problems, anxieties, conduct issues, criminal activity. I mean, we've got to think of, where does this lead? Where does it lead if we experience something and shove it away and push it away? Does that ever resurface? Right. Well, I think we've learned that it does, and causes problems that we can't connect to it anymore because we forgot that it happened so long ago. But ADHD is a daily thing. It's an always thing. And if it's just hey, this is just how I am, and it's hard to make changes if we don't identify that, that's how I am, but is that how I want to be? Am I effective in my relationships and my work? And if you are, great. Then it's not a disorder. It's not distressful. It's not causing, an issue. Then okay. But I think there's just so much more awareness now, and it's important that we just make sure we're staying on top of, hey, there's options, there's treatments. Yeah, right now it seems like people are being diagnosed so much or overdiagnosed. The statistics don't support that thesis at all. I think it's perspective of our opportunities to, in the information age, of realizing how many people that we communicate with now and hearing about it. And if it's within a family, right, likely within more family, and in a lot of places it's underdiagnosed. And I think if we think about it too, if we look at it in a geographic regional scale, you'll find clusters of things. You'll find clusters of bipolar. You'll find clusters of ADHD that, and more prevalent in certain places, just because we find our people.
All right. Last question.
Yep.
I just wanted to touch on you as a person. What made you so interested in ADHD specifically?
Well, earlier I'd mentioned how I found there's genetic, connections to what's going on when I was young, I didn't, I mean, you believe what, you know what I mean? Information you were grown up being told, or the information presented to you. Right. And I grew up in a world of where I felt like I wasn't good enough, or I wasn't smart, or I didn't, what are you going to do with yourself? You should go to college. Well, I can't even freaking get C's. Like, what do you mean go to college? And so we developed this self-doubt. And I mean, you can be on so many behavioral plans at school for being disruptive or fighting or whatever before you can't go anymore. And then what do you believe from that? So I became really interested in it because it's something that flew under the radar for so much of my life until I had important people in my life, say, hey, did you ever realize how many jobs you've had in the last 2 years? Like, what do you mean what are you talking about? Or how many car wrecks have you been in? Or how many times have, like you dealt with this or this or this, which are not common things. It's okay to change jobs. I'm not saying that, but I just get bored and quit and do a new job. And I had a family when I was young, and I had to work, and I knew I needed to go to school, but it felt overwhelming that that was something that I'd have to do to provide for my family. So I looked for any other option before I started going to school. And I really think I'm grateful for my experience of, having to learn that and struggle and build resilience, because it's made me a hard worker. I've had to, work twice as hard as everybody else to read the same chapter. It's probably taken me 4 times as long, but I still did it and then did the test, right? So I just found a passion of it because it hits so close to home, and I see so much suffering in my own family, like generational, trying to break that pattern, raise awareness. It's not all about medication. Like, yeah, medication can be helpful. It can be effective. But that's just part of the pie, like there's so many slices of the pie that we've got to consider. Where's it affecting things? And for ADHD is, it's probably one of the most important things to identify, because it's neurodevelopmental, right? It happens from childhood on. And how much is that going to affect someone else's life forever? It's going to affect it a lot. The decisions they make, the experiences they have, the, success, the achievement. And if you start developing a belief system that, yeah, the world sucks, or, whatever, I hate school, that's not going to help anybody, right? You're not going to be, I don't know. And I think that's where I've grown to just be so interested in it, passionate about it, and aware of it, and just try to decrease the stigma about it. I think that if we had more awareness, we'd probably have more schools that, kids didn't even have to have chairs, and they could just have standing desks of, an ADHD class. I don't know. I mean, there's stuff like that out there, but it's harder and harder to function in society when we make the school days longer, less breaks, and we expect all these, bright yellow round pegs to fit into a square hole, right? And so that's why I like it. That's why it's important to me.
Cool. Well, Nisha, thank you for coming.
Appreciate it.
Absolute pleasure.
Appreciate you having me.
Yeah, this is awesome.
Yeah.
So
likewise.
Cool. Redemption Psychiatry is a private practice located in Central Arizona. We focus on advanced treatments for depression, anxiety, and ADHD, as well as medication management and neurological testing. If you or a loved one is struggling with your mental health and lives in the greater Phoenix area, feel free to give us a call or visit our website today. Thanks.